power amongst my colleagues. I'm the clinical nurse specialist at the Pre-admission Clinic at the Broken Hill Hospital. My experience with the Innovations Award goes way back to 2011. It was exciting. I'd never heard of it before. It was introduced to me by a senior staff member. I became the pre-admission nurse after another nurse had been in the position for quite some time, and because I was new to the position, it gave me an opportunity to re-evaluate all of the practices that she'd been doing for quite some time. And that led me to my project, my very first project, which was really to improve the service that we were supplying to the patients at the hospital. And that it was exciting. I threw myself into it. It was very exciting. But a senior staff member, I was showing it to her, and she mentioned the Innovations Award. So that was my first introduction. And it was very exciting, very new to me, a bit daunting in the fact that I'd never done anything like that before. I did have some support, but didn't really know where to go, and that was a long time ago now. The second time I went into the Innovations Award, it was excellent because there's so much more support out there now. There was a project that was initiated by a staff member that wanted to collaborate, a group of people, and it ended up, we run this program. It was really beneficial. It was really good. It was something that hadn't been done here before, and because I knew of the Innovations Award previously, I thought that this was a good project to actually put in, to nominate into the Innovations Award. And when it was accepted, it was a surprise, as it always is. It's a bit exciting when you're putting the Innovations Award in. You're thinking to yourself, oh, you know, is it good enough? Is it, you know, what's it like? Is it going to be accepted? Always improve, always make improvements. The Innovations Award is there for that, but it's mainly, well, what I believe that it's mainly there for is to recognise the good work that the staff are doing. You know, they are doing things out there, and they don't realise that, you know, they can be recognised for that. It can go a long way. This can go all the way to clinical excellence. You know, this is things that can be recognised as it's an innovation. It's something that our staff can introduce to better the health of the service that we provide to the Broken Hill people. And, you know, I'm very proud of it, very proud of it. Yes, I got an award there at one stage, and that was very exciting. I would recommend, though, if you're going to do a project, think about the Innovations Award, but find somebody that's done it and find people that know how to do it properly. My first experience was pretty amateur, you know, it was very amateur. I just didn't do it very well at all, but still to make the finals and to actually have it presented, and it was a great learning thing. I've never done public speaking before, ever. If you're passionate about your project, you'll find it a lot easier to present it, to actually sell your project. So don't be afraid to put it out there. Don't be afraid to say, hey, I've got this project that I think is pretty good. I think that we could put it in the, nominate it. If it gets in the finals, great. But if it doesn't, don't dishearten about it. Just keep going and keep improving.